Well, welcome everyone. I know we have a really nice attendance today for our session today on regulatory business and compliance risks impacting your healthcare organization. My name is Scott Sissel. I am a partner in the Minneapolis office. I head up our healthcare internal audit services as well as the health system segment. I'm joined today with Rachel Pugliano, who is a senior manager in healthcare consulting. Rachel has some particular expertise in the compliance area as well as in the revenue cycle area. And quite frankly, Rachel's going to do a lot of the heavy lifting today around some of the presentation and some of those compliance and revenue cycle particular issues. So we'll be passing off the presentation to her in a few minutes after I give some overview comments. Also, I'd like to mention to you that this is the first in a four-part webinar series that we're putting on as part of our health system segment. Again, this one is a bit more of an overview on some of the more significant regulatory and business compliance risks. We're going to dive deeper on some of the topics that we'll hit on today in the remaining sessions, as you can see here on this slide. Information and data security risks. We're going to dive deeper into revenue cycle and understanding data and how that can help your compliance and internal audit plans. And then the final session is going to be a panel presentation where we've got some industry experts sitting in from the legal and consulting area around physician relationships and all the different compliance risks that might come into play, as well as other businesses related to physician relationships. So the website is also noted down below if any of you want to jump on and sign up for any of those further sessions as well. Today, the topics for today, there's a lot of things on the agenda. Some of these we will move through reasonably quickly. I will talk a little bit and give you some overview comments of what we're seeing in the industry. Rachel is going to dive a little bit deeper into legal regulatory compliance, compliance programming, risk assessment, revenue cycle topics, and then I'm going to come back and wrap it up on some of the other topics at the end: information security, supply chain, position, and other things to keep in mind as you are dealing with all the risks that are out there in the healthcare industry. To start with, maybe just a couple overview comments. I think anyone working in healthcare today, and frankly in other industries as well, is really challenged with continually monitoring your risks and dealing with that with limited resources. So many of you that are dealing with, are working in the compliance internal audit area need to not only perform risk assessments, but continually monitor them and update them on a continual basis. And I think where we stand today is not even is even more evident of that need to continually look at your risks. In the last several weeks, I've been out at some of our healthcare clients talking with executives, and they are clearly dealing with some challenges today. Things such as policies and procedures around masking, vaccination with respect to their own employee base, and access to their facilities, and what does that look like with respect to patients and guests. A recent surge that's occurred has now again put some of their resources in their facilities under continual strain, and continuing to look at options for inpatient beds, some of the COVID uptick and those sort of things. So again, it's a situation where you think you maybe know where you're headed, and then something comes back around with respect to the COVID, and you're readdressing those issues. Speaking of some of the things we talked about, vaccination mandates, those sort of things, health systems are challenged with making decisions around that, and people are continually evaluating those decisions, and that actually also brings up another significant issue, which is right now the resource constraints and the costs that are out there relative to caregivers, nursing costs. I've, like I said, in the last couple meetings I've had with healthcare executives, that's one of the first things that come up: the lack of resources, the need to look to contracted resources, and how those costs have really accelerated. Due to that cost acceleration, not only people costs, but also costs of supplies. these organizations and healthcare organizations need to continually look at their service lines and assess those on a routine basis, and really identify those that are critical to their mission, those that are contributing to the bottom line and to their mission, and making decisions as to what service lines are important from a variety of perspectives. And that's created a continual strain on the resources in the finance function, and looking at their finances and how they can continue to re-engineer processes, including clinical pathways and care delivery. And as I mentioned, resources become a significant issue for them, as well as facility management. I think most healthcare organizations in the last 12 to 18 months have had to relook at their facilities and how to better structure those to deal with infectious diseases, and then also look at their capital plans going forward, and what does the future look like given some of the rapidly changing ways that healthcare is being delivered. I think what we've seen in the last 12 to 18 months is an acceleration of telehealth, telemedicine. I think we see that will continue. The question is to what extent, and how does that affect some of the things that have historically been done in healthcare. From a standpoint of processes and controls, whether it be controls over business processes, controls over financial reporting, controls over compliance, I think that's another area that organizations have had to take a hard look at, because some of these processes and controls have changed. We'll talk a little bit about technology risks later on, but due to the advent of more remote workers, you have to deal with what are our policies relative to remote working, and then also, are we changing our policies and procedures, and is that creating additional risk in some way, shape, or form? And then finally, I alluded to this a little bit later, certainly policies, protocols around some of the things we've seen with COVID, and addressing public safety and how you address the needs of the public in your community are important as well, and certain things that are being the need to evaluate those on a continual basis. Other things, and I think Rachel will talk a little bit about those, compliance issues are still there. Certainly the CARES Act has created some opportunities and certainly some funding to ease the burden that all healthcare organizations have faced. There are now compliance requirements that are in place, and those will be something that all of you are probably facing right now as you go through the first round of some of the reporting that needs to be done for provider relief funds. OIG is still out there. I would say maybe in 2020, some of the regulatory activity and audit activity slowed down to some extent. However, I think most things I see and read is that will be a continued focus going forward. Certainly, there's a lot of concern around fraud relative to whether it be some of the CARES Act funding, billing, coding, telehealth, those sort of things are continually out there, and there's an expectation that will continue. And then, of course, with a relatively new administration, the question becomes how do they look at regulation going forward? Other significant issues, IT and cybersecurity. I think towards the end of 2020, the FBI came out with an alert that hackers are continuing to accelerate their focus on healthcare. I think some of that is driven by the fact that they identify the fact that healthcare has some valuable information that can be used in different ways and have value. And also, I think they identify that there's maybe more opportunity because of all the access points within healthcare organizations. Ransomware has become a bigger piece of that as well. Other things that are out there, I think all of you are probably dealing with some of the price transparency rules. I mentioned telemedicine. Government and politics, talked a little bit about that with a new administration. Certainly the political winds can shift, and that can certainly create additional issues or things that you need to focus on. Social mandates, a lot of focus right now around social mandates, not only some of the racial and ethnic disparities in the delivery of healthcare, which I think healthcare organizations need to continue to monitor, address, and react to, if you will. but also just within the workplace, some of those human resource type mandates that organizations need to continue to look at. Then finally, as I mentioned, physician integration still there, still a significant activity, and there's a whole host of issues around that, whether it be compliance, whether it be integration of physicians into the organization or other matters. I'll have a few things to say about that later on, although we do have a session down the road in November that will be much more extensive around that particular topic. And then finally, digital transformation and digital literacy are really the wave of the future. Certainly those digital organizations that were born digital, companies like Amazon, looking at how to enter the healthcare market and become more of a direct-to-consumer provider of healthcare services are competition for healthcare organizations. With that overview, I'm going to pass it along to Rachel to talk a little bit about legal and regulatory compliance. Rachel?
Thanks, Scott. So as Scott mentioned, I'll be talking a lot about compliance, and he mentioned a little bit about my background in revenue cycle and compliance. And I actually started out my career about 20 some odd years ago in the coding space. And after several years of working in industry coding, I made that move into compliance. And while I still largely focused on coding compliance, I was able to work for a couple of different types of entities, such as a university health system, as well as kind of a medium-sized national health system, where I was able to broaden my compliance experience into some other areas as well. And after some time, I moved into the compliance space, and I've been with Eide Bailly now for about 3.5 years. And so I'll work with clients still very closely in the coding and revenue cycle areas, and really focusing on that mid-cycle of the revenue cycle, as well as some broader compliance areas and compliance planning, compliance programming. So we'll talk a little bit today about compliance in general and what that program should look like, and then some specifics around areas that the OIG is focusing on, how that might play into your annual compliance plan, and those sorts of things. So this is kind of, just speaking to what some of the legal and compliance risks in general are. And so some of these legal pieces that this slide highlights is risks of lawsuits, and we'll give a couple of examples regarding safety, unexplained or misunderstood deaths, the increased HIPAA issues. And I think, Scott kind of pointed out to some of those things when it comes to security and cybersecurity and really protecting personal data. The security of our home networks. We have a lot of people working from home, logging in remotely, those types of things, even, patients accessing their own information from their home. And then employees then excessively accessing, PHI, looking at information that they shouldn't be looking at. And then some fraud risks that are related to that too. And some of these control issues would be new service lines that we develop at the organization. What are the vendors accessing and have the ability to see, and what that risk entails? Again, employees, and then the billing aspect. All of our billing is from a risk perspective. Not only is the billing correct, but then we have those access pieces as well. So compliance risks are continually changing. We have some highlights here regarding some compliance risks, but the provider relief funding, and that's all related to what happened regarding COVID. And I know we're still living in that. We all thought, I think, that we were seeing the light at the end of the tunnel, and now we're seemingly back into it again. But compliance around the conditions and reporting around provider relief funds, the accounting aspects, the cost and the lost revenue pieces of that, and really kind of the unknown on what all the audit requirements might be around provider relief funding. And those advanced payments and loans, the tracking and the reporting of those, and CMS issues, the temporary rules, the waivers that are in place, and then coding and documentation requirements related to COVID-19, which we'll talk a little bit more about further in this presentation. So now we'll kind of get into more of the compliance programming piece of it and really what the foundation of the compliance program would look like. So just to kind of set the stage on why do we have a compliance program in the first place, and that really was outlined by the OIG, the Officer of the Inspector General. And that is where really the foundation or the guidance came that every healthcare organization should have a compliance program in place. And they've also gone further to indicate what those requirements are, which we will talk about. And then also, what is a risk assessment, how to conduct a risk assessment, what that process looks like, and how that plays into your programming for your compliance plan. And then how do we assess that the program that we have in place is effective in that it's ultimately achieving the results that we would expect to see. So the OIG work plan is, it used to be where we could access the work plan on an annual basis, and it would really lay out, this is what the OIG is going to look like for the remainder of the year or for this next year. And now they've taken a different approach. A couple of years ago, they started updating that work plan pretty much on a monthly basis. So what I like to do is, same time every month, I'll go out there and take a look and see, well, what's new for the month of August on the OIG work plan? How does it impact my organization? Sometimes there might be things that aren't going to be related to what I'm working on or what my clients are working on, but it's good to monitor that on a monthly basis to see what's changed, what do we need to start incorporating into our plan, what needs to be on our radar. And then here's just a list of some more recently added pieces. Some of these have been on the work plan for several months. Others are relatively new. Provider relief funds, which we already talked about. Telehealth specifically during the PHE. We all know that there was at times daily changes to how we were supposed to be billing, and with the increased utilization of telehealth, especially during the early stages of the pandemic, we were unsure on day-to-day, how should we be reporting and billing for telehealth services. Now that we're a little bit past that and we have some more definitive guidance and some things have stayed in place for a good period of time, now the OIG is looking at some claims data and looking to see, have we been billing those correctly? Do we have the correct modifiers on the claims? Do we have the correct codes? Those sorts of things. They specifically do call out home health services during the PHE and the telehealth aspect of home health. And they do have quite a few nursing facility focused areas. And I think that really just, it seems based on what's happened with the pandemic that, nursing facilities were hit really hard during COVID. And there was a lot that was affecting them specifically. And so there's some pieces regarding nursing facilities that the OIG is looking at. And then shifting into a totally different area, dermatology E&M services that are billed on the same day as a minor procedure. So this is a very specific focused OIG area that is being looked at, and this pertains directly to professional coding for those dermatology services. So if you're an organization that has a dermatology clinic and you're billing those professional services, this is an area you probably want to take a look at and see, well, do we think that our billing and coding practices are accurate and in compliance? This is, the next one is spinal procedures. And again, that's more of a focused area for the OIG. And again, it's more focused on coding and it's specifically focused on pain management. So if you run any kind of a pain management clinic and are doing those types of pain injections for patients that have back pain, those might be some claims that you want to take a look at. And if you happen to be a critical access hospital and bill under Method 2, they are focusing specifically on duplicate billing for those professional services. So there are a couple of very, very specific areas on the work plan, and then there's some that might be a little bit more general, like we mentioned with the telehealth piece and the home health piece, that might be a little bit more broad. And so it's always a good idea to take a look at this OIG work plan on a monthly basis and see what areas might pertain to your organization. So here's just kind of a quick rundown of the elements of an effective compliance program as outlined by the OIG. And you'll see that there's 8 elements listed here. There's technically officially 7 elements, and that 8th element is the assessment of the effectiveness. It's kind of like the unofficial 8th element, and I wanted to include it on here since we're going to be talking about the assessment effectiveness as well. And I have a slide on each one of these, so we'll kind of go through that. So first element is having written standards in place. So this would be that written code of conduct. It would be having your compliance plan laid out in writing, and this would be specific to the organization. The OIG has specifically stated that they understand that a compliance program is not going to look the same for every organization. It's going to be very dependent on the type of organization, the size, and also the types of services that you offer. So they would expect to see that compliance plan is very, very closely tailored to the needs to that organization. They would also expect to see that there's probably going to be some coding and billing reviews as part of that compliance plan. And also quality, patients' rights, financial assistance policies, hiring practices for the organization. Those would all be things that the organization would tend to be looking at as part of their compliance plan. And policies and procedures. I know policies and procedures are time consuming to write. They're never fun to update, but as part of a compliance program, those policies and procedures are going to speak in writing for the organization on what that organization's philosophy, culture, standards, what their expectations are around compliance at the organization. And so you'll want to have those policies and procedures up to date. Screening is another big piece of your compliance program, and that applies to not just employees and new hires, but also ongoing, screening employees every year, screening providers, ensuring that the vendors are not on the excludes list, any business partners. So this really encompasses anyone that the organization is employing or doing business with. Education and training is a big part of the compliance program, and that is really geared and designed to ensure that everyone that is employed and working with the organization understands the expectations, they have read the code of conduct, they have attested to conducting themselves according to that code of conduct. And these are typically trainings that are conducted during new hire orientation, but then also annually for the employees. And there might be some areas that you want to focus a little bit differently on when it comes to education and training, and that would be those specialized areas. For instance, coding and billing is a high-risk area, so there might be some specialized training that's conducted there. For the board, for example, the board has a responsibility for being the leader in compliance and supporting that initiative. There might be some specialized training that needs to be geared towards the board. Communication is key when not just communicating that we have a compliance program, but really communicating to the employees the importance of that program and the expectations for all those that are working within the organization on reporting any kind of compliance issues that they see, feeling like there's an open door that they can go and report these issues either to their direct supervisor. If that's not comfortable for them to do that, going further to administration and having individuals there that they can talk with. Definitely the compliance officer, everyone in the organization should know who the compliance officer is and how to get a hold of that person. And then the hotline. And this is typically a toll-free number. Sometimes it might be an anonymous email or like a portal form that can be filled out where the employee can anonymously share with the organization a compliance concern that they have. Maybe they just don't feel comfortable having their name or going in person to have that conversation. So this is a way for them to anonymously report any concerns that they might have. And the reporting and documentation of these types of communications is really important to keep on file. So typically, for the hotline, it's usually a vendor that can provide this service to the organization, and the vendor will field all of those calls, and then they'll communicate back to the compliance officer what the call was about, what the nature of the situation is, so that compliance officer can then start conducting an investigation into the issue that was raised. All of these key pieces would then be recorded, and oftentimes with the hotline vendor, they'll issue a report every month showing these are all the calls that were received, this is the issue that was raised, and then this was the resolution of the issue. So outside of the hotline, you would still want to keep these same types of records so that you can show, should you be audited, but also just for historical purposes, this is the issue that was raised, this is the investigation that we conducted, this is what we found, and this is what we did in order to address the cause or the root issue that we found. And then ultimately corrective action, which is another one of the components of the compliance program. So auditing and monitoring, usually this is something that we see with every compliance program, that there's some level of auditing and monitoring happening, even if it's an annual coding review that takes place. But these auditing and monitoring activities can be proactive or reactive. Like I said, sometimes it might be an annual coding review that's performed on a retrospective basis. But if there's maybe an audit risk or an area of risk that's identified, say it's a new service line that's being started at the organization, or maybe it's a new group of providers that have been brought on. Maybe there's some pre-bill audits that are being conducted. Maybe some claims are held prior to billing in order to make sure, did we get all the codes on the claim correctly? Are the revenue codes correct? Did we get all the supplies, pharmaceuticals, the correct J codes with units? Those types of things that might be conducted more on a pre-bill or pre-payment type audit or monitoring program. And then also, what is the RAC activity at the organization or other regulatory reviews that are being conducted? Sometimes whatever the RAC is requesting might be an area that you want to take a little look and see, okay, well, they've requested these, 30 records. Let's see, what we find in those as well. So you're not surprised about the results, but then also you can then be prepared if you did find something, what might happen when that RAC review results come back. Denials data is a great tool and a great way to take a look at what issues might be happening more upstream in the revenue cycle that need to be addressed, and where that root cause can be identified and corrective action can take place before we ever even get to the point of having a denial. And then that ongoing monitoring really kind of follows the audit, and this would be when we put some corrective actions in place, we've done some education. Now we want to see, do we see improvement in the results from this work that we've done? We would expect to see that the billing is more accurate, or we're not having these types of issues being reported any longer. And oftentimes with this monitoring, we do need to create some sort of accountability so that there's a point person that's kind of in charge of making sure that we are following up on these issues, that we do have a monitoring program in place, and that we've got the training and educational needs met. Disciplinary guidelines, and it never is all that fun to talk about disciplinary measures, or I just messed up my slides there. Here we go. But it's important for those in the organization to understand that part of taking compliance seriously, and for the leadership in the organization to show that they are also serious about compliance, is that there are some measures taken when we have violations of our code of conduct or our compliance policies. So these disciplinary guidelines should be well publicized and clearly communicated to the employees. They should outline measures in writing, and they should be consistent. So what we don't want to see is that when an individual, and it's known that something happened, and that individual it's just kind of, they let it slide. And so then that speaks to the rest of the employees or individuals in the organization that, oh, well, I guess it's not that big of a deal when things happen. So that's why it's really important to have these clearly communicated and that there's that consistency. And then the corrective action. So we really talked about this a couple of slides ago as well, but this is following up on any of the reported or suspected violations, outlining the actions that are going to be taken to prevent this from happening in the future, utilizing data and reports to follow trends. This might be billing data, it might be denials data, something like that. really the design here is to prevent this violation or issue from reoccurring. And I know that that may not be 100% the case. There's, we're all human. There's going to be mistakes that might happen, but we do want to decrease the likelihood of this occurring again. And this corrective action then takes that step a little bit further to show that commitment to compliance practices. So we know we identified the issue. Well, now we're going to take it to that next step and try to make sure it doesn't happen again. So now I'm going to talk a little bit about the risk assessment and how that is really key and important for that annual compliance program. So typically a risk assessment is going to be conducted on an annual basis, and the purpose of it is to determine what are the areas within our organization that are of highest risk. And this will then help with determining what is going to be a part of our compliance plan development, what's going to be on our compliance plan. One way to put some of this information together or glean some of this information is getting feedback and interviewing staff, getting a sense of what they think from their perspective the organization is at risk of, taking a look at that OIG work plan, RAC activity, also prior audit results. Do you have some results from the previous year that maybe we need to do some follow-up audits on, or maybe we've got some providers that did great in the previous year's review, but now we've got some other providers that may need a little extra help, or having some challenges in some area. So taking a look at prior audits, and all of this is going to assist with compiling that compliance plan. And one thing I'll mention too is that we don't want to pack full the compliance program where we don't have any room for flexibility. There's going to be things that come up. There's going to be things throughout the OIG work plan, for example, that come on and fall off throughout the year. So we want to have flexibility in order to add those as needed, but also for the organization individually. If there's a new service line that maybe is going to happen mid-year, we want to reserve some room to take a look at that new service line and make sure that that's set up appropriately, the billing is appropriate, and those sorts of things. And also growth. Are there any acquisitions that are going to be taking place? Any new initiatives that the organization might be going through that you'll want to have as part of your compliance program and reserve some room for those. So when we're talking about the risk assessment, every organization is going to have a little bit of a different plan or scope around conducting that risk assessment. A small critical access hospital probably isn't going to interview as many individuals as a large health system might. So really determining how many people do we need to interview, what is the resource criteria that we need to use, and that's going to be specific to the organization. And then developing a ranking system based on that feedback that you receive from employees on those risks. How do we prioritize? How do we decide which one is a higher risk versus a lower risk? And then what time frame? Do we want to conduct this at the beginning of the fiscal year? Do we want to conduct it at the beginning of the calendar year? And that can be determined by the organization. And once you have those risks compiled from those interviews and from that feedback, I like to think of organizing them into buckets, and those buckets can be named different for the organization, but I think of compliance risks, financial risks, quality risks, cybersecurity. There might be a variety of buckets that work for your organization. And again, we'd want to apply the same ranking system within all of those buckets so that you move those higher priority items to the top of that list. And when you're developing the work plan in general, consider the resources that you have within your organization. It's great to have this well-developed, robust work plan for your organization, but if you don't have the people to actually carry out the auditing, the monitoring, the reviews, then that's not actually going to be in your best interest to have all of these items on the work plan. So looking at your internal resources, what can we accomplish with what we have in place right now versus what we might have to engage externally? There might be a risk area that you know you absolutely have to tackle this year, and you don't have the resources to do it, so you need to find someone to help you. What does that look like? What can the organization reasonably engage with in order to have that external resource? So again, I was just talking about resource considerations and being realistic around those expectations. And oftentimes organizations will engage an external resource, and they can be more of a partner in the work plan development and carrying out the actual compliance reviews for the organization. And they can more or less be used on an as-needed basis for some of these types of things. And when it comes to identifying the risk, the type of risk, and what the impact is to the organization, there can be like a matrix approach to it, more like a table where you list the risk. What is the likelihood of it occurring? What would be the impact to the organization? Would it be a financial impact? Is it more of a community or PR type impact? Is it something that would result in sanctions, those kinds of things? And then what are the mitigating factors, or what are the pieces in place at the organization that are already trying to prevent these types of risks from occurring? So the effectiveness piece is kind of that eighth element that we were talking about earlier. And so I just pulled from Wikipedia what this effectiveness means, and it's the capability of producing a desired result or the ability to produce the desired output. So this speaks exactly to all of those pieces that we have in place from our compliance program and the work that we've done on the risk assessment, identifying what we need to look at for our organization. And then how did that actually help the organization improve? Did we decrease the number of issues in a particular area? Have we mitigated the risk appropriately? And so we want to see, did we achieve our desired goal with the work that we've been doing? And I wanted to include this OIG resource guide. It's a large document. It's over 50 pages. And it's a metric system that they developed, and it's free. Anyone can access it, anyone can use it. And it goes through the 7 elements of compliance and really outlines within each element what are the various pieces and parts to each one of those elements that should be in place. And you can use that really kind of as a checklist. You could use that even assessing what you have in place for your program right now, and going through and looking to see, do we have this policy, is it updated? Do we have this type of training and education for our employees, or what do we need and what are the gaps? And so it's a really good document to look and see where are you at today, and then also to use, I would say, more like on the back end to see, is our program effective, and are we measuring up to these metrics that are outlined in this document? So I would highly encourage all of you to go to this document, and I've got the website here where you can access that. So some of the challenges or successes when it comes to program effectiveness is going to be culture. And that culture is really it's a leadership communication. It's knowing that the leaders in the organization, the board at the organization, are all behind the compliance aspects, and that they are pushing forward compliance initiatives and are supportive of compliance at the organization from the very top level. So it's a challenge if the organization doesn't have that culture, if they don't have board or leadership buy-in, if the reporting structure and authority isn't there for the compliance officer, if they haven't really been given that authority to make decisions and conduct investigations, that would be a barrier. Sometimes there's things that are out of our hands, such as systems and data limitations. For example, if our system just isn't designed very well to get the right kind of denials information, that might be an area that we need to look at improving, or finding a different way to get to that information so that we can really address denials and addressing the root cause of those. And resource constraints. That can be financial resources as well as personnel resources. And organizations that are really successful when it comes to program effectiveness is when there is that leadership engagement. And this is coming from the board to the compliance committee, to the CEO, CFO, and really communicating that from the top down. And I would say also having tools, and it sounds really simple to say have some graphs and some charts, but a lot of times it's really helpful to both employees, but also maybe when you're communicating to the board or the compliance committee, to be able to show within charts and graphs and different kinds of things and visuals on where your risk areas might lie, which areas need improvement, where do we need some more resources, and that sort of thing. And then how easy is it for the employees to access the hotline, to have a conversation with the compliance officer, or find someone in a leadership position that they feel comfortable going to and sharing a compliance concern. So I'm going to switch over to talking about some other revenue cycle specifically and some other hot topics when it comes to compliance, which we did touch on some already earlier in this presentation. I don't think it's probably any surprise that COVID-19 is a big hot topic for compliance. There was a lot of money being spent and pushed through for combating the pandemic, helping hospitals, ensuring that providers were able to bill and receive reimbursement for their services when it comes to taking care of these patients. So it's to be expected that there's a lot of COVID-19 initiatives for compliance. And then HIPAA compliance is something that we really tend to see every single year. It doesn't really go away, but having those business associate agreements in place, the controls piece, IT security. Are we conducting any type of cybersecurity audits throughout the year? And then I mentioned nursing homes before too, which was on the OIG Work Plan. And this is our vulnerable population. They really were hit hard during the pandemic, and it's still a focus area for protecting these individuals and these populations. And there's a big focus on quality at these nursing homes as well. Some more revenue cycle related areas, patient access. Are we completing the ABNs? Are we filling out the MSP questionnaires and ensuring that we're billing the Medicare program appropriately for the patient? Clinical documentation is very broad in general, but that plays into all the billing and all of the reimbursement that we receive. So if the clinical documentation isn't present in the medical record and doesn't support what we've billed and ultimately been reimbursed, then that's a risk area. Again, coding, appropriate coding, ensuring there's communication between coders and providers and that collaboration, the use of modifiers. There's a lot of new modifiers or maybe some old modifiers that came back into use during the pandemic that we need to make sure we're using appropriately. The charge master, and this is charge masters. Of course, we all have them in place. We've had them in place for many, many years, but we need to make sure that they're set up appropriately to bill for the service that we have it designed and set up to bill for, with the correct revenue code. The pricing is appropriate, and it's ultimately flowing through the system to end up on the bill correctly. Sometimes we can have the most perfect charge master, but if we're not able to select the right charge, either in the clinical area or from a coding perspective, then we can sometimes end up with the wrong charges or codes on the claim. And oftentimes we might have some multiple systems being utilized at the organization, and maybe the ER has a modular system that they absolutely love and never want to give up, and it has to interface with our main EHR. Do we have those interfaces set up appropriately so we're not losing or missing charges as that flows through, or something's not being changed that it shouldn't be? We've already talked about COVID-19 related billing, generally just claim submissions and clean claims, having that information on the claim that's appropriate. Denials management, I've mentioned a couple of times, and looking at that data and really moving to a model where we're identifying the root cause of the issue so that we are no longer fixing and resubmitting claims on the back end. And again, HIPAA. So I do have this slide here just regarding telehealth during the PHE and some of the billing nuances when it comes to billing these claims, some of the modifiers that are in place and the condition codes as well, and ensuring that these pieces and parts are on the claim forms and being utilized appropriately. All right, so I'm going to turn it back over to Scott to cover a couple other things before our time is up.
Thank you, Rachel. Appreciate that. And yeah, I am going to just run through just a handful of things here just to keep in mind, maybe for you to make sure you've got on your list of many things that you need to do. Information security, I did talk about that earlier, and we do have a session coming up on that specifically. There's some kind of interesting information here, I think, for you to kind of take home with you. You can see the trend in data breach incidences and the number of patients records affected, significant increase. I don't have the current information, but we believe that that has continued to accelerate. Ransomware has become much more common, and that raises really the issue of whether your organization has appropriate plans in place on how to address incidents that do occur. And if you do have a ransomware incident, do you have appropriate policies? Do you have backups planned? Do you have next steps, specific legal counsel that knows how to address these type of issues in place? Do you have insurance in place, quite frankly, for the costs related to that? So all those things are really important for organizations to have in place. And again, it's become a really significant issue relative to that. Why is it so important? Some things that many of you may know, but may not have seen before, but health information is considered 10 times more valuable than financial data. The average cost of a corporate breach, in fact, I think that number has increased substantially from this number, over $3 million for an organization, a reasonable size organization. So it's not insubstantial. I was at a session yesterday where someone talked about cybersecurity, and they talked about the cost of insurance. Insuring cyber incidents are really going through the roof. Many of you are using cloud-based servers. Cloud is just another server, quite frankly. It's just not within your four walls, and it creates a host of additional access issues into your system that you need to be aware of, and your information security professionals need to be on point and monitoring those. So the comment at the bottom, where are your entry points? Who has access? Is the access reviewed? I think are some takeaways to keep in mind, and to make sure that your processes and controls are considering those. Cybersecurity challenges, I would say probably the things such as multiple access points, use of third-party vendors are very important. I do think funding and investment and access to those information technology or information security professionals are a real challenge these days. This is just some information as a takeaway, some things to keep in mind that are important. Rachel did talk a little bit about those, but medical devices, something else that's important. Business continuity and disaster recovery. Do you have those plans in place? All really important things to keep in mind. And then I think if you step back from a governance and overall executive management oversight, I think it's important that management and the board has a process to review cybersecurity and information security processes and controls and risks on a routine basis. Boards and management look at financial statements monthly, and from a cybersecurity standpoint, these type of things should be regular discussions as well. I think the challenges that are out there, though, is oftentimes the leaders don't have that background. They didn't grow up in the technology era. And so it's important for each organization to make sure from a governance perspective and a management perspective, they've got the right skill sets and knowledge in place in order to appropriately address cybersecurity risks. And then what's important is building a cybersecurity culture through ongoing training and testing. Again, someone I just heard recently talk about cybersecurity in a financial institution basically said our biggest risk is between the desk and the laptop. And the fact that That's where most of the potential access and breaches can occur, individuals not keeping their guard up. And then coupled with that is remote working. And I've seen some recent surveys that have talked about the fact that 40% of respondents say that when they work remotely, they maybe are doing workarounds, are not paying as close attention to cyber risk. Maybe their Wi-Fi's aren't as secure as they would hope it would be. And all those sorts of things create additional risks in this remote working environment. Supply chain, just a couple thoughts on that. I think many of you probably are aware of the supply chain challenges that healthcare's face. Frankly, we've seen that in a lot of industries, the supply chain breakdowns and challenges. And that's been accelerated by the need for things like PPE and other types of healthcare related supplies. And oftentimes supply chain is internal organizations have focused internally on how to be most efficient and effective. And I think we're moving past that to ensuring that there is access to critical supplies and there's contingency planning around sourcing considerations. What vendors are you using? Who are your critical vendors? Couple of key thoughts around this area are making sure to reassess your supply base and understanding supplier performance and monitoring that performance as far as timeliness goes. Understanding your suppliers' risk mitigation plans as well. You know, what type of risks do they have to access those supplies? Contingency planning, having backup suppliers available in case you can't access the supplies you need when you need them. Of course, there's a cost to all that sort of stuff, but those are things that I think really need to be looked at. I think oftentimes people wanted to manage their supplies in a manner that they keep as little stock as possible. I think a lot of organizations are reassessing safety stock and what they really need to make sure they have those supplies necessary. Again, some of these are some of the things that lessons learned from COVID-19. And I think each organization should have a supply chain plan around identification of critical supplies and suppliers, business continuity in the event you do have issues, enhance emergency processes when there is a greater need, and then really looking at your suppliers. I've heard the term reshoring and demand surge contracting, which really means what are those suppliers that are closer to where you are? And if you do have a higher demand, how do you access those supplies? So again, those are all considerations around the supply chain and really new thoughts that have come into play really in the last 12 to 18 months. The other thing I mentioned is data analytics. Supply chain is really ripe for data analytics. You using the information you have, you can do a lot around turnover rate, timeliness, obsolescence, and cost metrics. So keep that in mind as you build out your data analytics plan. I know that's a data analytics is the whole topic for another session, but something to keep in mind as well. Physician relationships, again, our last session in our series will be talking directly about this. Practice acquisitions certainly are still out there. And I think it's important around the physician side to ensure that when you are looking at physician practice, you're paying attention to fraud and abuse statutes, particularly around Stark Law, anti-kickback provisions, contract provisions that are in place. Are they complied with? Do they meet some of these fraud and abuse statutes? And are they aligned with corporate objectives? And then, of course, as you bring on physicians or you're working with your physicians, you need to make sure they're aligned, not only from some of the backroom things like integration of scheduling, billing, IT, human resources, and overall management, but also physician engagement. Do you have effective clinical leadership? Are you dealing with some of these burnout work-life issues that are there? And are you also aligned from the standpoint of incentives relative to efficiency and productivity of physicians? Certainly, we've all seen those type of issues that health systems have faced around physician alignment, efficiency, effectiveness, and of course compliance on some of the matters that I just talked about. Other things to keep in mind, we see these as issues, particularly from a compliance and internal audits perspective. Joint ventures, again, they they may not be necessarily close to your core operations, and you may not have as much control or oversight. But oftentimes those are things that can create some issues for an organization, along with newer services or services that maybe aren't part of your core inpatient and outpatient activity. Third-party vendors, talked a little bit about some of the cybersecurity risks. Certainly contract compliance and effectiveness of those services provided by third-party vendors are important as well. And then finally, I'll probably just wrap up with maybe a little bit more around the human resource side. One of the real hot topics that are out there right now is environmental, social, and governance, ESG. And it deals with a lot of things. It deals with racial and ethnic disparities in care delivery, but also within your organizational ranks, your human resource policies, and really your workforce. And so I think that's an important thing to consider going forward. We've seen a lot more, particularly public companies, starting to actually talk about that in some of their public filings, their initiatives around this area. And it is a bit of an emerging area, but it's something I think that's gaining a lot of acceleration out there. Around workforce, a couple things. I mentioned competition from born digital organizations like Amazon, et cetera. But also I think within your organization, there's going to be a significant competition for talent, and that talent that has digital literacy. And so it's important to look at how you're addressing digital literacy, digital innovation, and do you have the right resources there, along with many of the other resources and constraints that I talked about earlier. So anyway, in a nutshell, there's certainly a significant amount of issues that all healthcare organizations are facing. More recently, some of the issues around patient safety, workforce safety, how you deal with COVID and the uptick in infections. The workforce issues have become certainly top of mind more recently. And then, of course, the variety of compliance issues that come with provider relief and other areas as well are quite significant.